Welcome to another session of Parent University On Demand. The DCPS mental health team is joining us today to share more about how families can practice first aid mental health at home. This is especially important for students who are adolescents.
Hello, my name is Katrina Brickhouse, and I serve as a clinical social worker on the school mental health team here at DCPS.
Hi, my name is Mineria Banks, and I serve as a program manager with the school mental health team here at DCPS. Our team's job is to decrease barriers to school success by providing students, school staff, and families with tools that promote academic and psychosocial growth and progress. Let's talk about how families can practice first aid mental health at home. Have you ever wondered if your teen's behavior is just that, the behavior of a teenager, or if it's a warning sign that they are experiencing a mental health challenge like anxiety, depression, or something else? And if it's a mental health challenge, do you know how to respond? Before we cover 5 steps you can follow to support your teenager's mental health should a challenge arise, we want to mention that this video's description box has a link to Youth Mental Health First Aid, which is a public education program that helps participants recognize and respond to signs of a mental health challenge in adolescence. Much like a standard first aid course, the Youth Mental Health First Aid course is not therapy, nor does it teach the skills to be a therapist. It's intended to simply provide information and build skills.
Let's look at the Youth Mental Health First Aid 5-step action plan called ALGIE that can help you support your child at home. ALGIE is an acronym for a step-by-step action plan to use when providing support to someone who may be experiencing a distressing situation, just as you would if you were administering first aid for a fall. The A is approach. Assess for risk of suicide or harm. Try to find a suitable time or place to start a conversation with your child, keeping their privacy and confidentiality in mind. If your child does not want to confide in you, please encourage them to talk to someone else they might trust. It can be hard to not react if your teen does not confide in you, which is key for our next step. L, listen non-judgmentally. Many people experiencing a challenge or distress want to be heard first, so let your child share without interrupting them. Try to have empathy for their situation. Do not compare your child's life with your own experiences from your childhood. You can get the conversation started by saying something like, "I noticed that." Try to be accepting, even if you don't agree with what they are saying. G, give reassurance and information. After your child has shared their experiences and emotions with you, be ready to provide hope and useful facts. You can try saying something like, "Thank you for sharing. I know that may have been difficult to share," or "I'm here for you." E, encourage appropriate professional help. The earlier your child gets help, the better their chances of recovery. It is important to offer support even if you might not have the answer right away. You can say something like, "I don't know what the best way is to proceed right now, but I will try to find out what options are available for you." E, encourage self-help and other support strategies. This includes helping your child identify their support network, programs within the community, and creating a personalized emotional and physical self-care plan. Self-care plans can be as simple as making sure regular touch points with you during the day or having quiet time at home to minimize feeling overstimulated. It is important to remember that there is no one-size-fits-all approach to executing these steps. You don't even have to use every single step to provide support, nor do you need to use these steps in any particular order, and every situation will be different. If you are ever in a crisis where your child is thinking about suicide, killing or harming themselves, or is acting erratically, call 911 immediately and tell the dispatcher that responders with specific training in mental health or crisis de-escalation are needed. In non-crisis situations, you can go through these steps to offer support.
If your child needs additional support, DCPS offers a wide variety of mental health and counseling supports at your child's school. To help you get the necessary support, the DCPS School Mental Health Team has developed a universal referral form. This process allows you to access all mental health and counseling supports in schools by completing just one form. There is a form for students to refer themselves and a form for others to refer students for services. This referral form is linked to this video's description box, as well as a more in-depth video focused on how to use this referral form. The DCPS School Mental Health Team, which includes the members of the DCPS School Mental Health Team and our partners, will review each referral and determine the best school mental health professional or counselor to meet the student's needs. Once this decision has been made, the assigned clinician will contact the student and the student's caregivers within 10 days to discuss next steps.
Next time you recognize your child is experiencing a mental health crisis, remember to try the steps of the Youth Mental Health First Aid 5-step action plan called ALGIE. A is approach, assess for risk of suicide or harm. L, listen non-judgmentally. G, give reassurance and information. E, encourage appropriate professional help. E, encourage self-help and other support strategies.
Thank you all for this information. We have a couple of frequently asked questions from our families, so let's go ahead and get started with that. The first question is, my child told me that sometimes I downplay the feelings they're having. What can I say to my child to make them feel seen and heard?
It's important to maintain a positive attitude and open mind to truly be supportive. Try using these mental health first aid tips to be an effective, non-judgmental listener for your child. First, reflect on your own state of mind. Before approaching your child with your concerns, it's important to make sure you are in the right frame of mind to talk and listen without being judgmental. Reflect on your own state of mind to make sure you are feeling calm, open, and ready to help. You may start the conversation by saying, "This is hard for me to talk about, and it may be difficult for you too, but..." Number 2, adopt an attitude of acceptance, genuineness, and empathy. Adopting an attitude of acceptance means respecting your child's feelings, personal values, and experiences as valid, even if they are different from your own or if you disagree with them. Taking time to imagine yourself in your child's place can help you be more genuine and empathetic. Number 3, use verbal skills to show you are listening. Simple verbal skills can help you show your child that you are actively listening. This includes asking questions, listening to tone of voice and nonverbal cues being used, using minimal prompts like "I see" and "ah," and not interrupting your child to give them time to express their thoughts and feelings. Silence is also powerful. It can help your child gather their thoughts and figure out what to say. So try to be comfortable with silence and allow your child to talk at a pace that's comfortable for them. And finally, maintain positive body language. Positive body language can show your child you're listening and truly care. This includes maintaining comfortable eye contact, neutral facial expressions, sitting down instead of standing, sitting alongside and angled towards your child rather than directly opposite him or her, and maintaining an open body position.
Thank you for your response. Another question that came in states, sometimes I see my child have a mental health situation and it triggers me, and I respond in ways that I later regret. What can I do in these situations?
As a first aider, you may experience stress before, during, or after helping your child through a crisis or non-crisis situation. It is a typical response to feel scared, exhausted, or emotional after giving first aid. Self-care is the practice of taking action to preserve or improve one's own mental or physical health. It is very important to take care of yourself so you can better care for others in your life. If possible, try to develop a self-care action plan prior to giving mental health first aid. It should not be something only done when feeling extreme stress. Remember, you can only do your best. It can be emotionally difficult to accept that your child needs mental health care. However, do not let the problem become the main focus of your relationship. Continue spending time, enjoying activities, and talking about other things.
All right. There is a final question here. It says, what do I do if my child expresses feeling sad to the point that they are thinking about hurting themselves?
If your child expresses feeling sad to the point that they are thinking about suicide, please get help immediately. The Youth Mental Health First Aid Program suggests that you approach these situations by letting your child know that you are concerned and that you want to help. Speaking in a calm, non-accusatory manner, ask your child directly if they are having thoughts of suicide or thinking about killing themselves. If the child has a plan, do not leave them alone. Appear confident, kind of like a duck on a pond, calm on the surface, but paddling hard internally to determine next steps. Some young people may not be able to respond to these questions, but you should observe their behaviors as well. Encourage your child to express their feelings. Be empathetic and focus on concern for their well-being. Talk about some of the specific problems they are experiencing. Let them know that there is help available to discuss those thoughts and feelings. And finally, remind your child that thoughts of suicide do not have to be acted on. Instill hope by asking them about long-term plans and letting them know that the feeling doesn't last forever. Again, please remember to connect your child with a professional. And if you don't feel you can keep your child and yourself safe, please get help immediately.
Let's get ready to close out. We know families are very busy and we covered a lot of information today. What would be the most impactful action families can take to practice first aid mental health at home?
Listen, educate, reassure, and seek professional help. Listen non-judgmentally to your child's thoughts and feelings or seek out a trusted adult that can do so. Educate yourselves on the changes that occurred during adolescence so that you can distinguish whether your child is experiencing a mental health challenge or disorder or simply experiencing normal developmental changes. Reassure your child that you care about them and help is available. Professional help is available. Please seek out a mental health professional to help guide your child into wellness. Thank you.
Thank you so much for being with us today. We truly appreciate your time. Families, please look at the description box to find more resources mentioned throughout this video. Additionally, you'll find a link to the survey. This survey takes 2 minutes to answer. We want to know if this information was useful and if you have any follow-up questions. As always, you can reach out to us via social media platforms or email at parentyou@k12.dc.gov.